When illness strikes, we look to doctors to give us answers. What if they can't? For these unlucky patients, diagnosis is a mystery. Mystery diagnosis.
For 45-year-old Paisley Smith, this is the case. She's been experiencing symptoms for over 20 years, but doctors can't seem to find a diagnosis.
You guys hear something? What the heck? Hey.
What's up, mate? Here's a snack.
Ooh, yum, thanks. My jaw!
Paisley!
Ow, my neck!
Hello, darkness, my old friend. Nick and Constantine.
Oh, my ear! Ah. Tiptoe through the window, by the window, that is where I'll be. Come tiptoe through the tulips with me. Oh, tiptoe from the garden, by the garden, along the ledge. Hey, running hurts my ear.
The next step in our investigation was to meet up with Miss Smith's sister, Angelica, and see what she has to say about the situation.
So can you tell me a little bit about yourself?
My name is Angelica. I'm Paisley's older sister.
So why have you decided to come see us?
It's just my last resort. I really want her to get better, and she's been having so many problems, and as an older sister, I need her to be healthy, and I need to make sure I'm taking care of her.
Can you tell us a little bit about her symptoms?
She's been having jaw pains, and it's just really hard for her to eat. She can't move around as easily, and it hurts like moving her neck, and her eardrums are really sensitive to things, and it's just a bunch of daily things that have just progressed.
How long has this been going on for?
Just too long, and it's just been 20 years, and I just need her to be better.
Next up, Angelica is going to meet with specialist doctor, Dr. Gunter, in hopes to find a diagnosis for her sister.
Hello, I'm Dr. Gunser from Hans Jopkins Hospital, and I'm here to investigate the case of Paisley Smith.
Next up, we met with Paisley Smith's parents to discuss her past issues and what they know about her condition. They meet with Dr. Gunter.
dad.
I'm Bethany Smith, Faceless Mother.
These symptoms first originate.
Well, back in 20 years ago, she was having issues in her studies, and at first we thought it was just because she was a little mentally unstable. She's not, and we realized she was having these underlying issues with her jaw. She kept hearing things, she kept having pain no matter what she did, she couldn't drink, she couldn't swallow. It was horrible, and we thought that after college and high school these issues went away, but they didn't. They came back with a vengeance.
Have you visited any other doctors previously?
No, she's too scared. She feels like she's gonna die or something, and she just doesn't want to hear the news, you know.
We'll do some examinations and see what seems to be the problem with her jaw.
Thank you, Dr. Gunther.
Following through with Dr. Gunter's plan, Miss Smith heads to the doctors and faces her fears in hopes of an explanation. Dr. Sanders, an ENT specialist from Alabama, joins in on the case, along with Dr. Scott, an otolaryngologist surgeon from Scotland.
Nice to meet you.
Hi. Nice to meet you.
Nice to meet you too.
Hello, I'm Dr. Gunther. Nice to meet you.
Nice to meet you too. And lay down, sweetheart.
Get the knives.
I'm scared. Don't worry, honey, you'll be just fine.
Not check the score yet. There seems to be a problem with her jaw.
I think we've got to know we've got to go to the x-rays.
Yes, ma'am.
How long will this take?
Don't be worried, it will only be about a minute.
Oh my goodness.
I can't believe my eyes.
So after finding our discoveries, what are we supposed to do next, guys?
I think we should order an MRI.
I agree.
After our discoveries with the X-ray, we went ahead and ordered an MRI and a CT scan with contrast.
Oh my gosh, is that bad?
Don't worry, everything will be alright.
The doctors meet again with the Smith sisters to discuss their final diagnosis.
My name is Dr. Sanders. Nice to meet you.
Nice to meet you too.
Good to see you again, Peyton.
We've come to conclusion about your diagnosis.
We have also come up with a treatment plan. It will not be too strenuous, so do not worry about that.
Oh my gosh, Paisley, I'm so happy that we finally found a diagnosis.
Okay, our first treatment plan involves non-surgical treatments, and it is composed of anti-inflammatory medications and injections of steroids and anesthetics. The hyoid bones inferior cornu or into the inferior torsilia fossa, which is in the most common non-out. This will help ease your symptoms but will not directly confront the issue.
So our next option is going to be a surgical option, and an incision is given along the ascending border of the ramus, cutting through meniscus and submeniscus. Then blunt dissection is done with a curved hemostat, therefore dissecting posteriorly, medial to the medial pygraphic muscle, and lateral to the superior constrictor muscle. The styloid apparatus is exposed, and incision is given along the peristeum, without disturbing the styloid attachments, of course. To deglove the styloid process, the naked styloid will be grasped between two hemostats, and it will be fractured. The fractured process will then be freed and removed. The muscles in the meniscus will be then closed and to attain a perfect closure. And the surgery has a success rate of about 80%, and it should successfully relieve you of all your symptoms. The major risk involved in this surgery will be the hemorrhage of the major blood vessels such as your carotid and your jugular, and there's also a risk of possible glycopharyngeal nerve damage. But with careful technique, these complications can be avoided. There's also some risk of not being able to taste and still having difficulty swallowing, but usually after the surgery, a couple months after, most of the complications have been resolved.
Oh no, surgery.
You're not working. This is your best chance of survival.
As pointed to on the mannequin, you can see the styloid process and how elongated it is. You can also see how close it is to the jugular and the carotid. With this view, you can see how the elongated styloid process hits against cranial nerves. Smith is fully recovered from her surgery and has no remaining symptoms from her disease. She now lives her life normally.
That's absolutely flipping insane.
Alright, are we good?
Oh, change my state of mind.
Ladies and gentlemen,
Love so hard to find.
we got him.
Domino's, what would you want? I need an MRI.
I love it. Cause your boyfriend is a dork. Make loving.
So what do you guys think about it?
Amber, you're the biggest dum-dum. That's not true.
Hello, I'm toxic. Wait.
She's kind of stupid, so she was around. Sam, she's not stupid. Alright, ready? Right there, do this. We're about to go for
Alright. Oh wait, I can't eat it.
You didn't eat it very well.
I like Oklahoma.
What's that?
Ew.
And y'all get mad at me.
No, because you are like a lost puppy. At least we're trying.
You're not make fun of her accent.
I'm Southern, if that makes you feel better. And he is, I don't know what you are.
We've come back.
No. Restart that. We're gonna restart.
And there's
It's fun to stay at the YMCA. It's fun to stay at the YMCA. They have everything for your men to enjoy. You can hang out with all the boys. It's fun to stay at the YMCA. It's fun to stay at the YMCA.
it's me. I'm
Is it?
What did you say?
What did you say?
You can still hear them, right? She doesn't, you don't like hear out of your eyes.
Young man, there's a place you can